We're live, Chair. Over to you.
Thank you. Good evening, everyone, and welcome to the remote meeting of the Inner North East Community Committee. My name is Councillor Mohammed Shahzad, and I will be chairing today's meeting. The Inner North East Community Committee covers the Chapel Allerton, Moortown and Roundhay wards, and is a committee where ward councillors have an opportunity to discuss and make decisions about services and priorities for the local area, and also consider funding applications regarding local community projects and youth activities. I would like to start the meeting today by confirming that today's community committee meets the requirements of the council's constitution, even though members are in remote attendance, and that members of the public are able to view the meeting via the live webcasting. As we begin the meeting, could I ask all attendees to mute their microphone unless I invite them to speak. This will avoid disruption from background noise. Members wishing to ask questions, make comment, should do so by using the raise hand facility on the Zoom facility. In order to avoid any disruption to the meeting, should I lose internet connectivity, Councillor Jane Dowson will step in as Vice Chair during my absence. Could I now invite members and officers to introduce themselves and mute your microphone once you've introduced yourself? I'll start with Councillor Charwood is not present at the moment. Councillor Jane Dowson.
Oops. Sorry, Chair. Yes, Councillor Dowson, Chapel Allerton ward.
Thank you, Councillor Dowson. Councillor Jacob Goddard has sent in his apologies today. He won't be able to make it for today's meeting. Councillor Sharon Hamilton.
Councillor Sharon Hamilton, Meanwood and Moortown ward.
Councillor Mohammed Rafiq is not on the screen as yet. So we'll move on to Councillor Angela Wenham.
Councillor Angela Wenham, representing the Roundhay ward.
And I think we've got apologies from Councillor Eleanor Tunnicliffe. I'll move on to the officers. Zaya Luna. Oh, sorry, Aline, apologies. And also our Lord Mayor and Councillor for the Councillor Eileen Taylor, if you'd like to introduce yourself, please.
Good evening, everyone. I'm Councillor Eileen Taylor and I represent Chapel Allerton ward.
Thank you, Councillor Taylor. And now we'll move on to the officers. Zahir Lunat.
Good evening, everyone. Zahir Lunat, Localities Officer for the Inner North East area.
And on to Carl Hinchcliffe.
Evening, everyone. My name is Carl Hinchcliffe and I'm the Community Committee Team Manager.
And I don't think so. We've got Liz Jarman with us. And the clerk for the night, Natasha Prosser.
Hello, everyone. Natasha Prosser, clerk to the Inner North East Community Committee.
And Mohammed Alameen.
Chair, he's not at this meeting. We've got Carla instead.
Carla, would you like to introduce yourself, please?
Hello, Carla Berwick. I am an engagement support officer for the community committees.
Thank you. And now we'll move on to the agenda items. Could I ask the clerk to go through agenda items number 1 to 6, please?
Thank you, Chair. So under agenda item number 1, there are no appeals against the refusal of inspection of documents. Under agenda item number 2, there are no items which require the exclusion of the press and public. Under agenda item number 3, I'm not aware of any late items of business, but some supplementary information was distributed to members in relation to the update report, agenda item 11. Under agenda item number 4, please could I ask members to declare any disclosable pecuniary interests? I'll take silence as none. And under agenda item number 5, apologies have been received on behalf of Councillor Goddard and Tunnicliffe. Under agenda item number 6, this is where we'd usually have the open forum part of the meeting, but on this occasion we've not received any written submissions from members of the public.
Thank you for that. And we'll move on to agenda item 7. Is the minutes of the last formal community committee held on 2nd December 2020. Do members accept that these minutes are true and correct record? I'll assume correct unless indicated otherwise. Are there any matters arising from the minutes? I'll take silence as no. And now we'll move on to agenda item 8, which is the COVID-19 vaccination program update. Could I invite Dr. Gay Barker, GP and Clinical Director of Central North Primary Care Network, and Dr. Amal Paul, GP Partner and Lead GP and PCN Clinical Director, to provide an update. And I'll go with Dr. Baker first, if that's okay.
Yeah, thanks, Councillor Shazad. So I'm Guy Baker. I'm a GP at Street Lane. I'm the Clinical Director for our PCN Central North. So our population is 70,000 approximately, and covers kind of Old Woodland, Moortown, down Chapel Allerton and down towards Little London and Meanwood. So back in December, we started a vaccination programme with little trepidation, but it's gone very well. Our hub's at Old Woodland Medical Centre, and we've been running principally a Saturday clinic, but with some midweek clinics every week since then. In terms of numbers, we've now vaccinated just over 20,000 patients, which is 35% of our total list of 70,000. Mainly first, but a small number of second vaccines, a mixture of the Pfizer and the AstraZeneca Oxford. We've been working through the priority cohorts. So if people are familiar with the 9 priority groups, we've done 94% of priority 1 over 80s, 94% of group 2, which is the 75 to 79-year-olds, 92% of this group 3, 70 to 74, 61% of group 4, which is a clinically extremely vulnerable, and we're now moving into groups 5 and finally group 6 as the first 6 priority groups. Very well received by patients and staff. There's a real goodwill feeling at the clinics. We've had volunteers staffing it, marshalling it. We've had volunteers vaccinating. In the icy snow days, community came together to clear the ice and snow, and there's been a real community feel from the whole exercise. So we're really enthused by the whole programme, really. We're going to carry on moving down the priority groups in due course, and we're hoping to have the groups finished within the next few weeks, certainly on the first vaccines. One issue which has been highlighted, national press, is an overrepresentation in the BAME community of people who have not been vaccinated. And I think public health colleagues are going to give us a further steer on approaches for that community. We've done direct patient approaches and telephone calls explaining the benefits of the vaccine, but we're interested in doing more for that group. I'll stop there, Councillor Shazad.
Thank you, Dr. Baker, for that. I would like to now call on Dr. Amal Paul to highlight what the situation is with the BAME community regards the vaccines and what can be done to increase the uptake and what is being done. If Dr. Paul, if you can highlight that for us, please. Thank you.
Thank you, Councillor Shazad. I'm a GP and a clinical director for Burbank, Hare Hills and Richmond Hill PCN. We serve a significant number of patients from the ethnic minority and deprived community. Possibly our PCN, the primary care network, is one of the most deprived part in the UK, and that is why we had the priority. And we started vaccination as one of the first wave on 14th of December. We had the first Pfizer vaccine delivered to our PCN. We anticipated the problem. Excuse me, please, just give me a second. Sorry. We anticipated from the beginning that we will have lots of problem from the acceptance of the vaccines by the ethnic minority and also people from the deprived community. It was discussed in our various sessions at the City Silver Group and the public health England Leeds leaders. And in reality, it happened. As for example, in my own practice, we have nearly 90% people who are from the ethnic minority community, and our uptake was only 12 to 15% at the beginning. And it was not uncommon for us. It was also something happened to other practices in our PCN. So we took a collective approach to see why there was so low uptake. We found out that there is a lots of issues, including, not exclusive, that there was a misinformation, mistrust, and also conspiracy theory. There is some genuine questions to be answered by the people who are offered the vaccine. Unfortunately, the approach from the NHS England and others are not as should be, as direct to the patient group. And initially we had the problem to overcome. We took the step for our patient by the practice to communicate to the patients directly. We try to contact them in their own languages. We involve the community leaders, mosques, and other religious leaders. And by now, in February, I can say in our practice, we have improved our uptake from 12 to 15% to 55%. And it has gone up throughout the PCN. The lessons learned from this COVID-19 vaccination, that it had just removed some plaster from the wound, and it's shown that's how we should work with ethnically diverse group of people. We should start very early to give information, to allay their anxiety, to answer the questions that are very genuine, like the questions of halal and haram. There's a question that whether there's enough blood in the vaccine, the question that whether the vaccines were safe or unsafe. So these questions, when were answered, then the uptake was improved. So I think we are now winning, but it's a gradual process. I only hope that we should continue our effort to engage the community rather than blaming them, providing answers to the genuine questions, allay their anxiety, and that is the way we can achieve their trust and their acceptance to the vaccines.
Thank you very much, Dr. Paul. Really appreciate that. And I think we have Alison here as well. I'm really sorry, Alison. I'm not going to try and pronounce your surname in case I get it wrong. So over to you, Alison. Thank you.
Do you just want me to introduce myself?
Yeah, please,
Yeah.
and let us know. Yeah.
Yeah, good evening. I'm Alison Sustakovsky. I'm one of the locality programme managers in the communities team. I work with Carl and Zahir and Carla. Thank you.
Thank you for that, Alison. Really appreciate that. Now I would like to call on Councillor Dowson because she raised her hand first for a question. Thank you.
Yeah, sorry about that. There's always lots of questions, aren't there? So the first one I'd like to put to Dr. Baker is with regard to priorities. I'm not sure how much independence practices have around the priority groups, because in certain practices there are a large number of older patients, in others it's younger patients and so on, but there are groups that in the past have been left out, and I was just wondering what priority, how you prioritize. I know you've got to use the national priority, but what leeway have you got with regard to people, say with learning disabilities, or people in key worker groups like teachers and so on? Is there any leeway, or do you very strictly stick to the NHS listings? And who actually sends out the invitations? Is it yourselves, or do they come out from the NHS? And then Dr. Paul, firstly, congratulations on getting your figures up to 55%. That's obviously taken a lot of hard work. So well done for that. And it might be one for you, but I understand we now have mobile units. And I'm just wondering if you could tell us what you think about those mobile units being placed in very strategic points, such as mosques and temples, to actually encourage people. I know in our wards, we've got the Islamic Centre and we've got the West Indian Centre, both of whom are very keen to help and take part. And I'm just wondering whether any faith venues have actually been approached in our venue. And that's all, Chair. Thank you.
Thank you, Councillor Dawson. If Dr. Baker, if you would like to take that, please.
Yeah, thank you, Councillor Dawson. There's a very strict steer from NHS England to go with the priority groups in order, which is largely age-based. In terms of specific about learning disability, we just had an update stating that learning disability, people living with learning disability are all now in the top 6 priority groups. I think one issue being the severe learning disability patients were always prioritised, but we couldn't gauge the severity. So now there's been a change in that prioritisation. Yes, we invite our patients through either text or phone call direct. There's a slightly confusing national invitation system as well, and people might well be aware that we've got Ellen Road. We did have Thackeray Museum at St James on stream, and we've got several community pharmacy hubs also vaccinating, and they have separate invite systems, which has caused a degree of confusion, but we're kind of working through that. So we are having people invited twice and people changing their minds about where they want to be vaccinated, etc. But it's a slight muddle through, but I think we're getting there in the end with that system. I think that answers all your questions, Councillor Dawson.
It does, thank you.
Yeah.
And can I call up onto Councillor Rafiq for his question, please?
Sorry, there was Dr. Paul. I asked a question about the mobile units, or perhaps using faith venues.
Apologies, sorry about that. Dr. Paul, can you answer that for Councillor Dawson, please?
Thank you, Councillor Dawson. The mobile unit was used for 2 reasons. One, to improve the access of the patients to the vaccinations, because some patients may not be able to travel to the center, and they might not have their transport, they might have difficulty to use the public transport, so on and so forth. So this was a good opportunity for the patients to go to the nearest center for the vaccination. Now, the second thing was the mobile center was used to encourage the people and to give some community reassurance that the community is involved. Like in the first thing was done in Birmingham, they used a mosque there to vaccinate the people, which really appreciated by the local community, including the Muslim community. Although it was a mosque, but it was not only for the Muslim, that everybody or anybody could walk in for the vaccination. And that gave a tremendous trust for the community people, because the community leaders are there. They told them, look, this vaccine is safe, come and get it. I have taken the vaccine, I have no problem. So that encouraged the people to increase the uptake. And the same approach we have taken in Leeds. There is mobile unit, and one of the place they possibly will choose is the Belal Mosque. And Belal Mosque is in Hare Hills, so whoever that you know that. And if it is done there, we are planning to do it maybe on Wednesday. There was some discussion, but I'm not sure when it will be done. It is in the heart of the ethnic minority people, the heart of the people who, the Muslim community in Hare Hills area, and the local community leaders, including the managers of the community center, they're involved. So that will help. Now, that vaccination center will be manned by the vaccinating team in our PCN, if it is going ahead, by the East Park team. they are doing the hundreds and thousands of vaccines. They have done so that experience. They will have all the protocols and the safety measures in place to make the vaccination process safe. And the main aim will be to improve the access and improve the uptake by the local community. Is it, have I answered your question, Councillor Dawson?
You have, Doctor. Thank you very much. My only follow-up to that, and I don't require an answer now, is I wonder why we haven't done it already.
That is my that was my question as well to the people. We have been asking them. I was one of them, one of the Kanika director who, when the vaccinations program started, we requested a local center at the Bangladeshi Center in Hare Hills, but the NHS England didn't accept that request. I requested later on again, that request was declined, but we learned the lesson, although it was late.
Thank you for that, and Dr. Paul. Just before I call in Councillor Rafiq to ask his question, can I introduce Laura Fitzgerald from the Public Health, please? Laura, if you would introduce yourself and give us your views on the vaccine and what's happening.
Hi, councillors and colleagues. Thank you for the invite tonight. I thought, to be honest, some of this that I've got in the presentation has actually already been covered. So I can send it out and it might kind of encapsulate the full conversation. But if I, the role kind of to come tonight was to talk about the inequalities plan that has been developed on the back of some of the comments that have been raised. And I can kind of update on the Bilal Centre as well, because I've been trying to kind of coordinate that logistically, and I can provide a bit of an update from the Chapeltown end as well. So in terms of the approach around inequalities is very much around trying to reduce and enhance access and make sure that no one is left behind in terms of the vaccine and access in that. There are three sides of a Venn diagram, and apologies, shall I try and share my screen with you all, and then you can see my can you just let me know if you could see that? Sorry, someone mine's nodding if you can see.
Yes, we can see
it.
Yeah.
If I show the slideshow. I'll zoom through this, but I can send it after for notes. But in terms of kind of looking at a proactive preventative approach, and this is a model that we've used throughout COVID, so trying to look at vulnerability from both the clinical and the social vulnerability side, and understand where in this Venn diagram we can kind of support people to access support for either testing, but also now the vaccinations and applying that. In terms of the approach that we're looking at, is kind of making sure that we are taking an outreach approach, and in terms of increasing access, we work with trusted people. So very much, I think one of the outcomes would be about how do we work with the community committee as a whole to kind of ensure that we're working with you, work on the trusted places. So again, links back to Councillor Dowson's comment about how do we work with places that people know and recognise, and then very much kind of co-designing messages to make sure that they land appropriately and link in to those to the relevant messages that are needed. As I've said, the strapline nationally, but also locally, is leaving no one behind, and making sure that people have had the right opportunity to either take up the vaccine or decline it, and that they've had the full information available to them. The aim of the plan is to mitigate against inequalities and make sure that we've got general access, and that's by making sure that we are kind of promoting and doing as much as we can in areas of deprivation, but then also within the vulnerable groups who are at risk, increased risk of illness and mortality from infection. The principles on which the plan's developed is around kind of co-production, and is very much linked back to the outbreak plan in terms of the key principles there as well, but very much about building confidence with communities to understand the needs and listening, so that we understand and we can respond appropriately, but alongside people as well, and make sure that the responses are timely and appropriate. We'll ensure that interventions identify and support those individuals who are considered vulnerable and underserved. Be diligent in the consideration of people with protected characteristics and follow equality guidance, and reflect the needs of local community, social excluded and socio-economically disadvantaged, and those with protected characteristics. I suppose in terms of what does that actually mean and what does it mean for your communities? So basically we're working with primary care networks in the most deprived areas of the city, and this is kind of before COVID, we were always doing this. So in terms of the Inner North East Community Committee, the main PCN that we are working with is Chapeltown. So I had the first meeting with the clinical directors on Friday to start to discuss how we can work with the PCN to identify any key areas or communities that we need to support the PCN in delivering the vaccination. Alongside that, we're also hosting an LCP workshop with the Central LCP, which will then also cover the Central North Leeds PCN as well. And we have a meeting tomorrow with Paula Deering, who's the practice manager at Rutland Lodge, who have a large practice population down in Little London as well, to try and look at communities that have a similar demographic as those in Chapeltown as well, and whether or not there's any learning that we have already that can support the practice as well in that area. If members haven't or would like to attend that LCP, I can get Rachel Insco from the LCP team to send on the invite if people would like to attend that. And the idea is that all of the work that we do is wrapping around the PCN delivery. So very much going along with the practices and the primary care networks to understand what the issues are, both for patients, but then also practically and operationally from a primary care network perspective, rather than it coming at it from a different point of view. As Dr. Paul's mentioned around the roving vaccine programme, there are three approaches that are currently in development. We are looking at a vaccination bus, so we've got actually a site visit tomorrow morning to look at. They are library buses that have been kind of transported into being a vaccination clinic, with the hope that we'll have two nurses or healthcare staff who will be able to provide the vaccination, and then the other two that we've got at the moment will then kind of provide a bit of an opportunity for people to come down and have a discussion with someone, and then if they would like the vaccination, they can then go into the other bus to have that. The approach is very new, so I think we kind of got sign off last week that we could start doing it. We will be looking at kind of supporting the PCNs that identify that they need additional support, and very much working with the PCNs around kind of the model and how that will work for their population, but then also working with you as well as counsellors to understand where you think the location of that is best served for the population. We're trying to kind of overlay a lot of data to make sure that we've got the right kind of blend against understanding the data and where the low uptake areas are, but then also local insight. So there's quite a lot of community engagement work also going on around how can we make sure that we're listening to what people need and we listen to the barriers and respond to those opportunities as well. The other one, as Dr. Paul has mentioned, is around the pop-up facility in a community venue. So the Bilal Centre is planned and hopefully will be launched in on the 10th of March is the date that we're working to. So and that will very much be around kind of providing a drop-in service, but then also bookable appointments alongside that kind of community leader being available or community connectors available to kind of talk to people about any kind of issues or concerns that they might have. The other is about a roving vaccination team. So that's delivered or will be delivered by the Leeds York Partnership Trust. And that will be kind of looking at how we go into specific settings where it might not be appropriate to kind of try and bring people out to primary care. So we'll have some specialist teams able to go into certain settings to vaccinate people. We will be kind of working with communities of interest that we've started to build a network throughout COVID, with kind of key organisations who represent different communities of interest. And we've sent out a letter to, I think there's about 50 commissioned services who work with different communities to understand the needs around vaccination so that we can incorporate that into the inequalities plan as we move forward and have some really dedicated time to that. Alongside all of this, there is a lot more of the kind of wider communications work that's going on. So Leeds was actually successful in securing some MHLG funding to support 75 local people to become ambassadors. So it's quite a strong programme of that, and it'll sit alongside the communities team, which Alison might be able to give you a bit more, but around kind of working with local community leaders or kind of people trusted in the community to have those conversations with people about the vaccine. So again, we'll link that in. The other side of it was around the Leeds CCG website has provided a really strong platform for a lot of FAQs and kind of different things that we've heard. So when we've been working with the PCNs, we've been trying to identify some of the barriers that are coming up and trying to work through some solutions or understand how we can learn from that in terms of the delivery of the vaccination. And a lot of that has then been linked back through into the FAQs on the CCG website. So I would urge that people kind of have a look at that, and if there are anything, is there anything else that we are missing? We're also developing a training program to kind of sit alongside. So again, at the LCPs, we're providing some low-level training, but we've also developed a want to know more session that's hosted on the Public Health Resource Centre website for anyone who's kind of working with communities to understand a little bit more about the vaccine and be able to talk confidently about those. There's also some work that we're looking to do potentially with primary care around how we support people to have conversations about the vaccine when people do ring or when they're ringing to book patients in, and trying to understand on a scale around kind of completely do not want the vaccine to kind of on the cusp of saying yes, but may have some hesitancy, and kind of how do we have a positive conversation building on the better conversations approach that we've got. So that's that bit. So that's the end of my presentation. I'm conscious I've gone through that quite quickly, but happy to take any questions, and I can also share that presentation after as well.
Yes, Shazad, I would like a question. Is that okay?
Yeah, Councillor Wenham, if you could just hold on. I've already got Councillor Rafiq waiting with his hand raised before everybody else. So if I could take Councillor Rafiq's question first, and then I'll come to yourself, Councillor Wenham. Is that okay?
Yes, that's okay. Thank you.
Councillor Rafiq, can you please
thank
ask
you, thank you, Councillor Shazad, and thank you, Dr. Baker and Dr. Paul and Laura for your experience, insights into what you're doing. Obviously, it goes without saying, all of you, particularly those who work in NHS or GP settings, have actually put in a phenomenal effort into where we are, not just with the vaccinations, but with the test and trace, but also all the other work we do with your patients as well on top of this. So, I mean, the more we say, the less it is in terms of, you know, the work done by colleagues within NHS settings. So going back to some of our points or observations, Chair, I'll just start with Laura's presentation, and that is, I think having the vaccinations in the community setting does help, because people start talking about it. You start having those conversations, and if one goes, and the other will follow. And I mean, one example you mentioned about the Infinity Centre next to Bilal Mosque, but I think we need to have it in different places as well. So, for instance, we need to have a facility in Chapeltown, because those living in Chapeltown may not, regardless of their background, they may be from the same background, or they won't go to all the way to. So, it's the more closer to home it is, I think, more likely people are to engage. No, that takes me to my next point about engaging, because there are a lot of myths out there. You know, the conspiracy theorists are work all the time, YouTubers, and I think there's a work collectively all of us could do, and I know a lot is being done in terms of comms, social media messages, And, we could use, people within our networks. For instance, you see sometimes on YouTube channels, group of doctors sitting down and talking about, the virus is a myth and, the vaccinations, the side effects and all that. And I think we need all the messages, whether you're a GP or elected member or a faith leader, to kind of get those messages out, because people, there's always people who are more likely, for instance, a message coming from a GP, then people are more likely to listen if it's a kind of posted on Facebook or some other social media channel than maybe, somebody like myself. But having said that, I mean, I've spoken to a lot of people, and eventually you don't win the argument if you have obviously all the answers there for people. So the issues which are circulating is, and this is what we need to put out, is things like, particularly amongst young people, and they put off the older, their parents or the elders as well. And that is one is around fertility, in the long term. The other is other sort of side effects, and then there's actually some people, Pfizer versus AstraZeneca, for instance. Some people I know have actually refused to take AstraZeneca because it's got more side effects or something. So I think we need to get those messages out, and comms is really important. I mean, for instance, there's so many elected members on this committee. I've not been personally approached by somebody within even public health or within to say, well, how my services could be utilised. There's a lot of the people, role models in the community, faith leaders, and other young people who are influential. And I think we could use all those people, as well as obviously the GPs. Yeah.
Thanks for that, Councillor Rafiq. Laura, would you like to answer that question from Councillor Rafiq?
Yes, thank you. I do have an update from Shaq Rafiq, who's been leading on the comms from the NHS CCG in terms of an update of things that have been going on. I completely agree in terms of kind of working with partners who have the reach into different communities. So we had a conversation at the Hatch LCP about working with BHI, who did a local webinar to kind of understand what's going on. The other kind of thing that we've been doing is starting to work on community engagement plans with the communities team. So very much working with Carl and Alison around how do we start to look at who knows who in the local area, and how do we use the networks that you all have. So certainly I'm sure over the next week or so we'll be coming to you kind of asking for that exact so yeah, it was lovely that you've been able to provide that for us, really, because you are kind of really respected in the community and have those local links. So it's definitely something that we'll be looking to explore with you and try and link that up. And I suppose the other comment around as well, kind of around where we host those community settings, whether or not it's the bus or a community venue, will definitely be, again, we'll kind of come to you to consult with where that might be and the best location for that, knowing the communities and where would be most suitable. So definitely we agree with that. I think the only caveat is that we'll be working with the PCN to identify any specific areas or kind of cohorts of patients and where that might fit best, and then look at where we might then approach. Just because of the JCVI cohort at the minute, we can't go mass bookings and things like that. We have to be really stringent about who gets invited and who is able to access the vaccine. Hopefully in the summer that won't be an issue, but at the moment we have to be really clear on the cohorts that we're engaging with. So we'll very much kind of be working with the PCN and then coming back out to partners and members to engage you in that process as well.
Councillor Rafiq, do you have a follow-up? Is that okay? Is that answered for you? Councillor Rafiq, you're still muted.
Yeah, no, I'm fine with that. I know that there isn't a perfect answer for everything, and there's a lot of obviously question marks, even for some of the questions I've asked, because there isn't a ready-made answer. I think that's something we need to work together. The only other thing I was going to say is some of the maybe the two doctors on the call maybe answer some of the myths around why people don't want to have it. I mentioned fertility. I mentioned about the side effects. Whether how we actually have comms to kind of to stamp those out. Yeah, arguments.
Mute button. Sorry about that. Dr. Paul, would you be able to answer that regards to fertility and other myths, if possible?
Thank you, Councillor Shaz. Yes, the myth around infertility and or fertility and the uptake by the young women is really a tricky issue. If we step back and we think of when the COVID-19 vaccination was started, JCVI, they advised that the corona vaccination was contraindicated in pregnancy, and also you have to wait 3 months before you can start planning for a baby. This was the first message which really impacted on the mind of the young generation, young women and men. Now, after a couple of months, there was lots of study, there was lots of research, and then JCVI and also Royal College of Obstetricians and Gynecologists, they come up and they told us, well, COVID-19 vaccination is not contraindicated in pregnancy. It is safe in pregnancy, and you don't have to wait 3 months after vaccination to start family. So this is the confusing message the public got from the JCVI and the MHRA, these people. Now, the truth is, at this moment, data suggests that corona vaccination available in our country, that is Pfizer, BioNTech, and AstraZeneca, are safe in pregnancy, safe in the breastfeeding, and you don't have to wait 3 months after vaccination to start a family. However, this vaccination is very new. We don't know a long-term effect. And on that basis, they suggested that the vaccination should not be given every pregnant woman, only to be given the people who are at increased risk of dying from this infection, like members of the BMA community, healthcare workers, including the doctors, nurses, and other frontline people. They should take the vaccine. And also the people who will take the vaccination knowingly that there is some uncertainties inside the vaccination program. The safety is not yet 100%. But there is also suggestions that because the vaccine is inert, there is no active particle, active virus in this vaccine, it is very unlikely it can affect, but we don't know. Because this is a dead virus, and there is no active virus in the vaccine, they suggested that this vaccine should not impair any fertility. There is some myth that if you take the vaccine, it will go to your gene, it will impair your semen, so you can have abnormal babies, and so on and so forth. So far, the research study we have got that does not support that one.
Thank you, Dr. Paul. Really appreciate that, Dr. Paul. I'm really sorry I've had to cut you short slightly there. I'll take the last 2 questions on this because we are slightly running over our time, and I'm sure we could probably spend the whole committee meeting discussing this, and it's a very important issue. But can I get in Councillor Angela Wenham before I go to Councillor Hamilton for her question, please?
Thanks, Shazad. I will make it very brief. Thanks for the presentation. What I would say, my question really starts at the presentation. When the presentation were given out, it was saying the BAME community. To me, it wasn't clear. Was it emphasis on, because BAME covers a wide diversity of different communities. To me, it sounds like it's only covering one part of the BAME community. Number 2, they were saying that the BAME community, well, the Black and BAME community is not, the take up on it is very low. But whoever I'm in contact with, they have all had the vaccine, especially my mother-in-law, who is 90. She had it the first week of January, and she's worrying when will she get the second one, because it's a very long gap. Thank you.
Dr. Baker, would you like to answer that question, please?
Yeah, so I don't know the statistics of the subgroups within BAM community. I think my only comment would be that I think the BAME community is overrepresented in the non-vaccine groups, but even so, as Amal has pointed out, the rates are significant, they're increasing, and they're relatively high. They're just not quite at the 94% rates in the Romanian community. I'll stop there, Councillor Shazad.
Thank you, Dr. Baker. Laura, do you have anything to add to that? If you've got the statistics?
I don't have the statistics to hand, I'm sorry, Councillor, but the only other thing is I agree with Councillor Wenham in terms of the BAME as a group, rather than kind of breaking it down to different communities, and that's certainly something that we've identified. So we are working with kind of breaking down, because when we've done a lot of the LCP sessions, we've actually identified that there are different barriers for different communities. So yes, the presentation does kind of create a one group when actually there are different communities experiencing different barriers and kind of and different things going on in terms of access. So completely agree, and I'll try and maybe rephrase some of that the presentation going forward as well. So thank you for that.
Thank you for that. And can I ask Councillor Hamilton to ask a question now, please?
Shazad, just wait a minute. I did ask about, as I say, my mother-in-law has had her vaccine the first week of January, and she's 90 years old, and she's wondering when will she get the second vaccine? Is that on the way or not? Thank you.
Dr. Paul, would you like to answer that, please?
Thank you, Councillor. What I can say, as far as we are aware, everybody who had the first dose will get the second dose. Initially, it was a plan that the second dose will be given in between 3 to 4 weeks. Now, according to government policy, it should be given in between 10 to 12 weeks, possibly 11 to 12 weeks, but it may be a bit earlier. But so far, we have been told, and I believe it is, that everybody will have the second dose, but they have to wait. They will get a letter from the GP surgery for that second dose.
Thank you for that, Dr. Paul.
Thank you.
Thanks.
And can I turn to now Councillor Hamilton to ask a question, please? And that'll be the final question on this topic.
Thanks. My question is regarding, there's a lot of focus on the BAME community. Lots of input is being put in areas for the BAME community. My question is it only the BAME community that is not taking up the vaccine? We talk about conspiracy theories, lots of myths out there. Is that only via the BAME community? And and obviously Angela has asked my question. There's other communities, and I would like to see the figures of the take-up, because there's a lot of concentration on the BAME community mobile, demystifying the myths. But what about the other community? Is there no conspiracy theories there? From the beginning of this pandemic, the focus has been on the BAME community. And to me, I feel that there's some sort of divide. Yes, we need to encourage them to take it if they want it. My opinion is you take it if you want it, as long as you get all the full information, get clarification with all your questions. But can I just get that information with regards to that? And also the ambassadors are going to be trained in media, and what else? What is their full role? You know, what are they going to do? How are they going to encourage other people? I mean, are they going to also be giving vaccine? And then you said about the mobile buses. How many mobile buses are there going to be? And how many staff are going to staff those? So those are my questions. But I really would like to know what take up from the other communities apart from just the BAME community. And don't they have any worries and concerns? That's all my questions.
Thank you, Councillor Hamilton. Can I pass that on to Laura to answer? Is that okay with you, Laura?
Yeah, that's fine. I suppose, Councillor Hamilton, just to reassure you, I suppose it's working with trying to look at the levels of vulnerability and trying to kind of look at it from a clinical and social vulnerability lens. So while it might look like we're focusing on BAME, it's not kind of just specific to that, to BAME communities. It is across the full population. So there is a lot of work kind of going on generally across the city around kind of key messages and information, and especially kind of the issue around fertility doesn't just rest in one particular community. So there are kind of citywide comms plans that we're doing. In terms of the approach with the PCN, again, it's very much based on the data that is being identified within each of those PCNs that we're working with, and trying to make sure that they are localised and they're not just kind of focusing on specific things that we think are there. So very much working with yourselves and local care partnerships to identify particular issues for different communities, as opposed to just working with as a topic of BAME. That's not the intention at all. And then the other kind of link in around the mobile buses, there is a potential of 4. We're currently working on the basis of having 2 live initially, because obviously in terms of logistics and being able to potentially go back out and redo the second vaccination, we just need to be clear on the logistics, and again working with the PCNs to identify where they go and where there is additional need. I suppose the other thing is just making sure that people are aware and have all of the information, as you rightly say, in terms of knowing the access that they have. In some of the inner city areas, we're aware that not everyone is registered with primary care, and again, because that is like the main method of accessing the vaccine, we don't want to miss anyone out. So I suppose working in those inner city areas is, as a general piece of work, is around primary care access and increasing registration with primary care, as well as accessing the vaccination, not only for kind of the immediate COVID response, but also longer term support around their health and well-being. Does that answer your question?
I think
yes, thank you.
Yeah, I think that's fine. Thank you, Councillor Hamilton. And have we got Councillor Eileen Taylor there at the moment? I think Councillor Eileen Taylor did have her hand raised up, but I think it's gone down. Right. I would like to thank Dr. Paul, Alison, Dr. Baker, and Laura from Public Health for coming and discussing the COVID vaccine rollout. And I would also like to thank the fellow councillors for their good questions that they've asked, and I hope some of these questions that have not been answered, you can email us back to our localities officer Zai Lunat, and so we can actually get those answers. And I'm hoping before you leave, we might get Councillor Eileen Taylor back. Councillor Taylor, are you back?
I'm here, sorry.
Yes, thank you. Just before the people from Public Health leave, can you, as a BAME person, can you, and as the Lord Mayor, as a very important citizen of the city, can you tell us about your experience of the vaccine before everybody leaves, and the community committee, what it's like to actually have the vaccine?
Yeah, my experience of the vaccine, first can I say, I would like to thank the scientists that really bring this vaccine forwards. As you know, the past few months has been challenged for us all, and we was in a dark zone, and this vaccine has brought us back to light and hope in the future. And also all the doctors and the medical teams behind the scene. I'm volunteering at the Woodhouse Medical Center, weekly basic, and now Councillor Pryor joined me at the Woodhouse Medical Center. But what I would like to say, myself, my husband, and another colleague have had the vaccine. I personally haven't had a reaction to the vaccine. I was fine. It's as though I didn't have a vaccine. However, my husband and my colleague, they had the requirement, what they said to expect, a headache, nausea, and just a cramp. It didn't last for long. It lasted a few hours and they were fine. I've listened to all the comments today around the BAME and the other ethnicity group. First, I can say I do understand why BAME are reluctant to go for it. You all know in the past, BAME's Black people, including myself, did use as a guinea pig. And I think that is the myth from history. But on the other hand, fake news is terrible. It spreads and it goes viral and it lasts uncontrolled. When this virus started, as the Lord Mayor, I had so many calls, so many texts telling me the reason for the virus. This is what happened. I've had the cure for the virus, and then it's escalated. So we just have to bear with each other. And I urge everyone, as you know, I do a lot of promotion on it for NHS to go through. I've witnessed it's one container, not 4 containers, one. And the medication, what's in that one container, goes for white, Black, Asian, and whatever groups. And so if you don't get pregnant, I wouldn't say it's not the vaccine. And all medication come with some side effects. It affects some and it doesn't affect the others. And I urge everyone to go for it. Just put race, color aside and have it if we want to protect our loved ones and get back to normality. Thank you.
Thank you very much, Lord Mayor Eileen Taylor, for telling us about your experience of the vaccine. And I would again like to thank the health professionals that have come today, and thank you for your time, and thank you for spending such an extended time with us, even though we were supposed to be there for 30 minutes. We really, really appreciate your time. And I, as the chair, would also urge people to actually, when they're called up, to get the vaccine. And once again, thank you, Dr. Paul, Dr. Baker, Alison, and to Laura for attending today's meeting. Thank you.
Thank you.
And now I would like to move on to the next item, which before I move on to agenda item 9, I would like to bring forward an element of the update report. But unfortunately, the update report on the unemployment was on the employment and skills as requested by ourselves in the last meeting. And our lead for that, Councillor Goddard, is not able to make it today for personal reasons. So therefore, I would like to call up on our Executive Board Member for Learning, Skills and Employment, Councillor Jonathan Pryor, to actually give us an update on the figures that we have got for our area, which are found on page 46 on our Community Committee report. And over to Councillor Pryor, if you could introduce yourself and then let us know what regards the report on the employment and skills.
Thank you, Councillor Shazad. Yeah, I'm Councillor Jonathan Pryor, and I'm the Cabinet Member for Learning, Skills and Employment. Employment, obviously, is one of those areas which is a focus every year. Kind of in normal times, we're really looking at those furthest from the job market. So maybe those people who have an element of disability or perhaps being out of work for a long time. But obviously with COVID, the employment landscape is changing quite rapidly, with a lot of people finding themselves, a lot more people finding themselves out of work. So I was just going to speak very briefly around the report you've all received and just very briefly around some of the changes we're making to the employment service at the council, and then more than happy to answer any questions you all have. So you will have kind of this in the report in front of you, which goes through the universal credit figures, which obviously have gone up in every ward, and this is true across the city, kind of regardless of wealth, demographics, anything. You know, we are seeing a massive increase in people claiming universal credit. Our own employment and skill services, which has a kind of several different tracks of work about helping people improve their skills, getting people back into work, helping people, just kind of marrying them up with services. So last year, between April and December, across the inner northeast area, we got an additional 216 people into work. Now, this is quite a decrease. I think it's 30-something%, a decrease of 30-something% based on the same period in 2019. But we are still kind of pushing to get people into work. That decreases from there just being fewer jobs out there at the moment. A lot of companies were putting people on furlough rather than kind of putting more and more adverts out, but we are still working on that. And actually what we're looking to do in the future is obviously kind of rejig some of our employment services. As I said at the beginning, a lot of it is geared towards those furthest from the labour market, whereas over the next kind of 6 months to a year, we're going to have a huge number of people who find themselves out of work, but they're actually highly employable. You know, they're ready to just step right into the next job. So we're looking about kind of seeing what we can do with kind of the big employers in the city, using our kind of networks with all the anchor institutions to make sure we can basically turn people around, get them straight back into a job, and then that's what will help our city recover. In terms of kind of the high street and the city centre, obviously we've seen a lot of closures of shops and bars, and seeing kind of which age groups are hit the hardest. You know, that's the sort of thing which we hope will recover fairly fast. You know, once the world gradually gets back to normal, more things can reopen, more people can get back to work. I was looking at some data over the weekend that actually, because usually it's the 18 to 24 bracket which is the hardest hit, but actually that increasingly it's that 25 to 35 bracket. There are a huge number of programs about getting kind of young people, getting those NEET figures down, and actually now it's that slightly older group who still don't have the most secure jobs in the world. Those are the ones who are getting hit because they're not also kind of catching all those programs to get young people back into work. And it is people who've got 0-hour contracts, who have got part-time work that have been hit the most heavily. There's a high correlation between people who have that part-time work, as well as the specific sectors that have been hit the hardest with women. So kind of a lot more women have found themselves out of work than men. I mean, we know that the pandemic, you know, hasn't hit the country in an equal way. So we are looking at kind of how we can kind of resolve that the most. In terms of apprenticeships, we still ran the apprenticeship festival. We moved online this year, and so we're able to kind of match people up. We're working on the apprenticeship levy to make sure that's still happening. And I was really pleased at the budget council last week that Councillor Lewis, the leader, made the commitment that if anyone finds themselves unable to finish their apprenticeship because of COVID, because of what's happening with the company they're working for, we as Leeds City Council will help them finish that apprenticeship. And I think that is such an important guarantee. It means we can either kind of help that company with the funding to help them finish it, or we can match them up with a new company so they can finish that qualification there. I'll leave it there for now as just a quick run through, but more than happy to kind of go where any members want to ask any questions.
Thank you for that, Councillor Pryor. Really appreciate that. Have any of the councillors got any questions? I've not really seen any raised hands.
I don't have any question, but just to say that, I mean, obviously we're in a pandemic, we're in lockdown, so we do understand, but you know, once things start changing and we're going back to some sort of normality, obviously we'll be looking for changes and, you know, improvement. And we normally have once a year at the arena, don't we, where all the jobs and everything, so, you know, for young people. I think it was it done online this year, but it won't be the same thing, will it? So yeah, we do understand, and probably that's why we don't have any question, because we can't do much about it at this moment. Thanks, Jonathan.
Yeah, I mean, you're absolutely right. Kind of, we're still in quite a difficult time now. So really, what the work we're doing now is almost preparing for when the world comes back to normal. So kind of when it does, we can hit the ground running and get people straight back out there. We're looking into doing kind of things like big job fairs and the apprenticeship fair was online this year, but we'll be working all year round to try and kind of get more people into them as well. But you're absolutely right. I mean, still in lockdown now, so it's not the easiest thing in the world.
If I could, Chair, just add, you know, I mean, it goes without saying that, you know, the work of the, you know, those working employment skills team has probably doubled over the last 12 months. And that's sadly due to many people, obviously, be one of the victims of the pandemic, losing, apart from obviously, you know, suffering health-wise, but also losing, you know, jobs or businesses as well, and hence, you know, claiming benefits. And like Councillor Hamilton said, it's never easy, kind of, when you know, rewriting your CV or help with job search. It's not as easy as if you see somebody in person. So, you know, you got to diversify, and all I can say is, Jonathan, if you can pass on our, you know, gratitude to, you know, everyone in your team for all they're doing, really appreciate it. Yeah.
Thank you, Councillor Rafiq, for your kind words. Just a quick question for Councillor Pryor from myself, since there's no one else raising their hands.
I have got a question, actually.
Have you, Councillor Wenham? You're not using the raised hand facility, but go on, fire away, Councillor Wenham. I'll let you go first.
Mine is to Jonathan Pryor. Councillor Jonathan Pryor. He's doing an excellent job. I know it's difficult at this moment, but one of my main concerns, and one of my concerns for ages, is 0-hour contracts. Can we try to work together to sort some sort of problem with 0-hour contracts? We should try hard to get rid of 0-hour contracts, because mainly it's the younger ones that's on those 0-hour contracts, and mainly women, who is having to do 2 and 3 jobs when they're on the 0-hour contracts. That's if and when they get any work. Thank you.
Councillor Wenham, you're absolutely right that they are a huge problem. There's something that were created for kind of a very specific circumstance, 0-hour contracts. You know, as a student, I had a 0-hour contract, and it was when kind of I was doing exams and I didn't want to do that. But they've essentially been abused now, and kind of they're given to people where it's really inappropriate to have. You know, if you're working in a shop, why on earth does a shop need to give out 0-hour contract? You know, I'm sure you've read them in the news. They know exactly how many people they need every day, and it is a real issue. It affects kind of certain demographics more than others. People who did have 0-hour contracts are the people who've been hit hardest by the pandemic as well. We've been doing a lot of work with our anchor institutions, as well as our trade unions, on something called the Great Jobs Agenda. I don't know if you've seen this, and it's about making sure that people don't just have a job, they have a job where they're paid, you know, a fair pays wage for a fair day's work. They've got prospects in the future. They've got training opportunities. You know, it's a career path. It's something that gives them that security. So across I think we've got 11 anchor institutions, to the point where it's 1 in 7 jobs in Leeds is working for these anchor institutions. And across these, we've done things like making sure that people are being paid the Living Wage Foundation, real living wage, reducing and getting rid of 0-hour contracts. And the hope is, you know, if we get kind of these big employers on board, if we get them kind of treating their employees well, I mean, to be honest, a lot of them, we're pushing an open door. They are kind of good employers. But what it does, it then kind of encourages the other companies to do the same. You know, you're kind of leading by example. You know, it's a competitive market out there for jobs. So if we kind of improve those jobs across the piece, then others will follow. To get rid of them completely would be difficult. That it would, you know, to be a bit political, it would require a change of government, which I would be delighted for, but I think might be a few years off. But we're doing everything we can in Leeds to kind of reduce our dependence on them, absolutely. But yeah, no, you raise a really important point.
Thank you, Jonathan.
And since there's no one else to ask a question, Councillor Pryor, I would like to ask you, as you can see from the figures, the rates, and I'm sure it's the same in all the wards throughout the city, but more or less in every ward in our patch in the inner northeast, the universal credit claimants has doubled, I mean, going forward, as we're coming out of this pandemic, would you be looking at maybe holding a skills fair or a jobs fair up in our ward? So maybe people who might not actually come to the arena, but I will not wait for the next year, maybe consider something to take them out to the actual community committees or areas specifically, so certain jobs can be targeted towards them, or people can be aware of those employment opportunities.
I'd be more than happy to kind of to work with the community committee to do that. We obviously do have kind of the big jobs fairs, but we've done lots of kind of smaller versions around the city in the past, you know, targeting kind of different communities, different areas of the workforce. So I'd be more than happy to look at that. I have a feeling that I can't remember which one, but I think one community committee has done one themselves in the past, and I'm more than happy to assist with that. It's really interesting you talk about the kind of the rise in universal credit, and what's really interesting is how a lot of the country have realised that it's barely enough to get by on at all. Obviously, nationally, we're campaigning for the £20 increase to become a permanent one. But when you look at polling on people across the country on whether they think that the benefits in the UK are too high, about right, too low, before the pandemic, I think it was something like 45% of the country thought that benefits were too high in this country. That has halved. It's now kind of less than 20% of the country think that. And the number of people that think the welfare system isn't good enough has massively risen. And it's because loads of people have been forced now to live off it. And they've really seen that it's not enough. And that's exactly why it is so important we do things like run more job fairs, get people back into work, get people back on their feet. And I think you're right, kind of doing them locally would be a huge benefit. There are a huge number of people in the city who don't drive. I don't drive. So, you know, if I lived slightly further out, I'd be, you know, I wouldn't be able to, it would be difficult to come into the centre, to come to a sort of job fair. And when you look at people kind of aged kind of 18 to 30, increasing numbers just don't have a car at all. So kind of providing things on people's doorsteps will become even more important. So yeah, more than happy to look at that.
I would like to thank you, Councillor Pryor, A, for your answer, and B, for waiting patiently because we were running late. And I know you're really busy as an executive board member. We really appreciate you attending our community committee today. And apologies that Councillor Goddard, who is our lead member for this, was not able to make it today. But once again, thank you for myself and the whole of the community committee for attending our meeting today. Thank you very much, Councillor Pryor.
Thank you very much. I'll see you all later.
Thank you, thanks. And now we will move on to agenda item number 9, which is connecting Leeds transport strategy. Could I invite Finn Campbell, team leader, city development, and Paul Foster, when they do come on, if you could both introduce yourself as you give us the update and the presentation on connecting Leeds transport strategy. So I will turn to Finn Campbell first, please.
Good evening, Councillor. I'm Finn Campbell. I'm team leader for forward planning. I'm here to present the draft transport strategy to you all. Paul there?
Yeah, Paul's there.
Hi.
Paul, thanks.
Yeah, hi, Councillor. Thank you. Yeah, I'm Paul Foster. I'm Transport Strategy Manager at Leeds City Council. So between Finn, myself, and others in the team, we've been pulling this strategy together over the last year or so. It's out to consultation at the moment, and it went through executive board in December as a draft for that consultation. And I believe a number of you may have seen sort of presentations we've done at Labour Group or through executive board as well. So I'm conscious of time, Chair, just to sort of ask, do you want me to sort of run through this relatively quickly and then we'll have more time for discussion, or do you want a sort of a fuller briefing on the strategy?
I think if you could run through it quickly and then the councillors can actually ask you the questions. I think most of us are aware at the Labour Group we've had this. And then also if you could send the link to our localities officer, you could then share it on our Facebook page, any presentation or the link to the consultation. Thank you.
Chair, can I just suggest that, yes, it would be good to kind of have a quick run through, but most importantly, I think it would be helpful the knock-on effect, of the strategy will have within the, our northeast area, the wards, the transport changes and all that. So the road networks and everything, I think that's more relevant to us and obviously our residents. So, I think between us, we know obviously what connecting these transport strategy is to an extent, but it would be more kind of just to refresh our minds just as what kind of means for Leeds Northeast, if you.
Yeah, okay,
that's a really good suggestion, Councillor Rafiq. So if you can kind of link it more to our community committee area, I would really appreciate that. Thank you.
Okay, I'll do my best. Okay, so Finn will just get the presentation up for you. Okay, so as I say, so briefly, the vision for the strategy is about a city where you don't need a car, and that's about giving. And I thought Councillor Pryor there almost gave me a segue into this, didn't he, with his last comments and on that. This is about making sure that everyone in the city has an affordable, zero carbon, healthy choice on how they do every journey. And I really, when I've been presenting this, I stress the everyone and the every journey bit. So what the strategy is looking at is a whole broad range of solutions. There's not one thing we're going to do. We have to address a number of things and give people a range of options to do all the journeys, to participate in the city as they need to. So it's based on the sort of the three pillars of, if you like, of our strategies as a council in terms of tackling climate change, delivering inclusive growth, and improving health and well-being. And the strategy and the transport effects are being built in, and they're almost a check against, as we put in schemes, are they contributing to these three things in different ways? And essentially the best way to do all of these is to get a transfer from the private car to public transport, to walking and cycling, and to almost travel less distance as part of that. And so that essentially it contributes to all those things, particularly in terms of reducing the cost impact on people. And I'm sure the residents of this area are particularly aware of the cost of transport in terms of the amount of their income that takes up. And so providing more efficient services or encouraging that active travel, it can reduce that overall cost for people and make it better. So that they're the key objectives. Skip forward. We've set ourselves some targets within that in terms of mode share. We've also got a real focus on the casualty reduction as well, and talking about a vision zero, which is where no one would be killed or seriously injured on Leeds roads by 2040. So really reducing that impact that that transport has on our health as well, with air quality and casualties. So the next one, what the particular focus on, I think what's changed in the last few years as we've been developing transport policies and strategies is the climate emergency and that need to go zero emission. Transport is about a third of all emissions in the city, and therefore, it's going to take a huge monumental effort to get that down to zero by 2030. And we've set out a number of things in the strategy that we feel you could do that would get us so far. The blue line, get us to about a 43% reduction. We've done a bit of a sensitivity test around the effects of COVID and whether people will work at home more in the future, and that probably gets down to 50%. But you can still say that's only halfway there with what we've sort of set out in the strategy as the sort of things we really want to do. So we've suggested a series of other measures as well that might go on top of that, which I think we've got highlighted on the next slide, which is around things that really try to change behaviours, if you like, the sticks rather than just the carrots. So things like workplace parking levy, a low carbon zone, and how then, if we got that income as a council or an authority, how could we reinvest that in making public transport cheaper, building better cycle infrastructure, walking infrastructure? How do we reinvest that? And we haven't set out exactly how we want to, what we're going to do with that funding if we were to get it, but we're asking the question through this consultation about how supportive people are of those measures and what we should do with the funding if when that comes through from that. So I think that's one of the key questions to ask, and maybe when councillors are giving my questions, just some comments on that. How much further should we go, and which of these measures do you feel are appropriate, and obviously how they would affect, you know, the in the northeast area particularly. Okay, if I move on to the next slide. So the bulk of the strategy is in what we've called in these 6 big moves. So these are the areas of focus that we're looking at. I've talked a little bit in the past one about decarbonising transport. There's also work in terms of electrifying or hydrogen even fuel types for vehicles, whether that's private vehicles or those essential vehicles, you know, freight deliveries. You know, the council's already leading by example, and we've got one of the biggest electric vehicle fleets of all councils in the country. And, you know, it's about, again, you know, that same example that Councillor Pryor gave about, you know, get the anchor institutions and the council to lead by example and others take that up. So that's what we're trying to work on with that. The creating healthier streets, spaces and communities. Now that's really a focus on that local level intervention. So an example of that, well, two very good examples that I know of in Chapel Allerton ward, in terms of the Methleys, where we put in a home zone probably 15 years ago, maybe more, which is sort of about, you know, how do we create that street environment that really works for people, that encourages that the ease of walking out your door and continuing on those journeys, making that local community work in terms of the street design. And then I guess the other example is where we've done it with the temporary measures in Chapel Town. And again, you know, how do we take that forward? How do you do that sort of scheme with a bit more money, a bit more investment, a bit more time, a bit more consultation, and a bit more buy-in from the community? How would you build that up and make the street environment within our communities conducive to, you know, to walking, cycling around, and make them pleasant places to be? And then associated with that, then you move on to the main routes in and out of the city, and how do we use those? How do you link into the district centres that are the heartbeat of the local communities as well? So again, thinking about how we link them to the residential areas that surround them, and how we connect those key places into the other destinations where people might work or go for education, etc. There's a whole chapter on transforming the city centre, and again that's similar principles in terms of how do we make the city centre work for us? How is it easy to get about there? How is it easy to get to there for the employment opportunities, and also its function as a, if you like, a hub? If you think of Leeds train station and the places you can access from that, you know, we want that to be an easy journey for people to get to from surrounding communities, and then interchange and go on to other opportunities. So the people of inner northeast, for instance, could be looking at taking up job opportunities in Huddersfield or Wakefield, rather than just being limited to sort of more local areas. So that's where that feeds in. Enhancing public transport. I've never been to a community committee where the bus network hasn't come up, and the key role it plays, the real need that people have for improvements in that field. So I think that's something, again, and I'm sure you can all give me specific examples there where we have to make this better. And the strategy sets out how we want to work with the combined authority and the bus operators to get a virtuous circle for public transport. We need to get more people using it, which brings in the income for the bus operators, which then needs to be reinvested. So we need more buses to make sure that they're not full when they go through Chapel Town and Meanwood. We need to make sure that they don't just serve those routes to the city centre, that there are options for you to go orbitally round to other places that you need to go in the city. So making those changes are necessary, and, you know, as I say, working with the combined authority and the operators to try and get that working. And our part as the highway authority is to look at how we can invest in the priority for the buses. So bus lanes and doing clever things with the signals to make sure that they can run quickly, avoid the congestion, and therefore, you know, if a bus only takes 10 minutes less on its route round, it can go around more, and that gives you more capacity for the people to use. So, and reduces the cost for the bus operators to provide that capacity. So that's where we're doing that. New mobility solutions is very much looking at how, if you like, I sometimes think about this as sort of the Netflix or the Spotify of transport. How do we get that shared ownership working? Or, you know, you just use the service for the times you need to use it. So things like, obviously that's already in place to an extent with taxi and private hire services in the city, but how else can we do that in terms of shared bike schemes, car clubs, and even demand responsive transport, which is like minibuses, public transport run, but they go to where, you know, a number of people need to go and they set their route, a bit like a shared Uber type of system. And then finally, mass transit. So the probably less relevant for northeast, but the combined authority have put out their vision for that recently. That's out for consultation as well at the moment. And that's looking at the places it needs to serve. But again, that's about creating better opportunities to connect areas around and through West Yorkshire. So, you know, it takes some time, but really it's about adding that into the mix where bus doesn't quite do the job, where there isn't strategic rail, there's a gap in between where a tram type system could work for that. So that's the work we're doing. We're doing a lot of detail below that. What we've dug out, just to sort of remind councillors, is when we came and did the transport conversation in 2016, these were the key issues that the Inner North East talked about. So, as I say, public transport is slow and expensive. You know, that clearly is the message we get a number of times. Again, that orbital journeys point that I made. I think this is probably a very, in terms of the cars coming through the area, you know, the car ownership within the wards that you represent is probably well below the city average, but yet the effects of transport in terms of the emissions and the road safety issues that you have are very prevalent in the area. So how can we reduce that? Sheepscar interchange barriers, again, that's about how you know, we're talking about those connections from community to the city centre, and we've, you know, obviously the City Connect cycle scheme is being on site at the moment, nearly completed, but yeah, appreciate that Sheepscar is a huge area that needs looking at how we can address that over time. And an outer ring road cycle provision, well, which we started, and I think, you know, hopefully you can see there is a network beginning to emerge of safe cycle routes in the city, but we know we have got a lot more to do on that. Okay, I'm nearly done, Chair. So the conversation is open at the moment. There's the links here, they're on the website, and if you can't copy them down, and we will share those. I'm sure they were in the note that came out with the papers, but if you Google Connecting Leeds transport strategy, you usually get to the right place. There's an email address if people want to write to us, and we will do some paper copies if people do really need them, but obviously with the pandemic it's a lot, you know, we're sort of restricted to these online types of communication, aren't we? We're looking at putting some posters up to try and again engage more people who maybe haven't come across it in their whatever their social media feeds or the engagement they have online. And again, conscious that in some of the areas there isn't that internet and availability for everyone. So going to put some posters up, and we need to we'll probably talk to the community team around where those best locations are. Live till the 26th of March. I think, and then the next thing is we are doing a series of webinars. I don't know if anyone's seen any of these or been able to tune in on these various topics that I talked about. Tomorrow's one, which Councillor Carlisle is at, as well as members from Sustrans and other experts that we've got coming to that, is on the healthiest streets, spaces and communities, so it might be of interest to members. And the mass transit is on Thursday. Yeah, so and public transport next week. So they're sorry, what was I going to say? Yeah, the ones that we have already done are available on YouTube for people to look back. So again, it's all linked on that page on the website, so you can look at some of the others if you've got some time to kill. Okay, so I think my request really from members is I'm happy to take questions about what's in there, what we're doing, but I would like maybe in your intro whether you feel that we've got it right, what have we omitted, and then that point around, this is an old slide, Finn, around what applies to we are doing every community committee. What are the priorities for your area? Okay, thank you very much, Chair.
Thank you for that, Paul. A very detailed presentation. I would like to put it out to the floor. Councillors, do you have any questions? I think Councillor Dowson has written a few in the chat. So, Councillor Dowson, I'll go with you first.
Thank you. But Paul knows all my concerns, and the problem is you've got to deal with the reality and then work to the expectation that things are actually going to get better. The reality is, in an inner city area, whilst you've said it, whilst car ownership might be quite low, the number of cars coming through that area is absolutely phenomenal. And I bang on all the time about the amount of rat running. You know, the complaints we get day in, day out about cars taking shortcuts. And we point out again and again and again how this actually affects the main routes. And I pointed one out on the notes, you know, and it affects Moortown as well. The number of people who actually cut through the area to come out of the Potter Newton roundabout is actually stopping traffic on Scott Hall Road because the priority is from there. And I see it because I actually use that route when I come into Leeds, so I can see what's happening. And because it's backed up down Scott Hall Road, they then cut down Wensley Drive, through the Hen Connors, through the St Martins. Well, they used to do till you put those barriers in, but through the St Martins and popped out on Chapeltown Road or Scott Hall Road at the bottom. People will actually find a way around these areas. We do need to work on the worst rat runs, especially the ones that actually will stop you achieving your ambition, which is actually speeding up the bus routes to get more people on the bus. And particularly the one through the Miles Hills and Moortown is a phenomenal one. If you could actually stop some of the traffic using that and keep it on Scott Hall Road, you'd do a huge service to everybody. But sometimes when you're talking about rat running, you feel like you're banging your head against a brick wall, because we've been talking about this since I became a councillor 15 years ago, and we're still not closing those rat runs off. It just seems very disheartening sometimes to feel you know the solution but nobody's listening, mostly because we don't have the money, and that's the answer that we get most of the time.
I think that's probably, you've almost answered your own question in terms of that, Councillor Dawson. But I think as well, this is going to be an increasing area of focus that we can do, and we have been successful in getting some funding to implement schemes this year in this area as well. So we've got an opportunity now, and I know Dave O'Donoghue and the team are going to come and talk to members about the detail of what we can do there. So some of these key rat runs are really what we want to focus on with that scheme. So I think it's quite opportune, really, that, you know, I'm sorry it's taken this long, but I do think we have an opportunity now to start tackling that. And but what it does need, doesn't it, and we've seen with the closures that we have put in, is we do need that groundswell of support to tackle the problem and to implement it and to do it, and you know, the confidence that is the right solution and that traffic isn't wanted in those areas. But to get that closure in, some of the residents that live there are going to be slightly inconvenienced, and they have to take that balance between the two, don't we? That's the balance
If
that we're.
Chair, I may come back just briefly on that
trade-off.
one.
So yeah, but
Yeah,
that is the trade-off we've got to.
But
we've got to
the lack of
negotiate with the community, isn't it?
consultation is a huge issue, obviously, for the scheme you're talking about. But
Yeah.
often the government funding comes in, as it did in this case, at very, very short notice. We've had it time and time again, you know, the town centre programme and so on. All of it comes in at very short notice, and the schemes that get the go-ahead are the ones that are almost ready to run, or the sort of the ones that you perceive are actually going to be easiest to implement because there's a groundswell behind them. Is there not a place for doing this consultation? And I suppose this is part of it that you're doing now with local residents, not just elected members, to actually get some schemes ready to run, so that when you do actually have that money coming in, you have had some discussions already around what people would like?
Oh yeah, I mean that's the utopia for us. I think some of the issues are we're so busy either bidding for the funding or trying to deliver the schemes we've got to do with that funding, with the resources available, that we haven't got that plan for the whole city and those areas developed up in advance. But we are trying to work on that and make that, you know, that has to be the way we've got to move it forward and get in a better place with that. So with the online tools that we've got now, I think it is easier to do that level of engagement. You know, we at the start of the pandemic, we put out on the website and asked for people's suggestions of what we could do for active travel, and we got 26,000 responses. You know, so compared to, you know, how long would it have taken us to do that, going to you know, community halls, etc. You know, it is a lot easier to do now. So we're starting to build up that picture of where the support is for these measures, and the ones that we've highlighted for this particular scheme have come from that. So I think that's a positive aspect. But I have to say that this is an area, in terms of those local focused schemes, where we do need to make the case for much more funding in that area. There's a lot of funding comes from national government that is earmarked for, if you like, schemes that are of the sort of £5 to £10 million mark, you know, and they take a while to develop. They're significant schemes, but there's so many small individual things that can be done in localities and neighbourhoods that don't get the similar level of attention. So we are trying to keep pushing that message, but it is more challenging.
Thank you for your answer, Paul. And can I go to Councillor Rafiq? He's got his hand raised for a question. Thank you.
Thank you, Chair, and thank you, Paul, for the presentation. And I think you're quite right. You know, we've got a lot of challenges in terms of getting more people onto buses, more people walking, more cycling. But the question is, how do you do that? By just having the infrastructures doesn't always help. One of the biggest problem we have is actually more people. You're quite right, more people. The only way you could reduce car usage is to more people jumping onto public transport. Yes, you will get people cycling, but that percentage is very, very small at the moment, and it's not going to increase in the near future. Not the rate we want to see. You know, I'm afraid. I know by me saying that, I'm not going to be very popular in certain quarters, but that's the truth. Yes, I think as a result of the pandemic, there's more people maybe walking as well, and I think it's something we need to encourage more. But the real problem is actually, and I've said this before in a scrutiny, it's actually the cost of reliable public transport, because until that becomes, as long as it's in private ownership, run by private companies, it's not going to be cheap. You know, until those buses are deregulated or whatever the term is, I don't think we'll have the level of the sort of transport we want to see here, which is cheap, efficient, and on time, quick, like you see in some of the other European, other sort of world-class cities. And until that happens, people are not going to start. So that is a big thing, and it's not something we could just do. That's something I think government sort of level, we need to have those powers to kind of make that happen, but also funding to go with it as well. So, just to give an example, if you jump onto a bus, let's say from Old Woodley or even beyond from Harrogate, it's much cheaper than somebody who actually hops onto the bus from Chapeltown Road to go into. It costs you like £2-3 to go for each way. You rather get somebody, a member of your family, to do that extra journey, drop you off, or use if you can park it somewhere too. So it's not rocket science, no brainer why people want to use when you can't. A, the buses are full once they get through because there's not many, and B, or they come all together, and B, they're too expensive. So that's the problem with wards like our ward, Chapel Alton, and even Moortown as well, and Rounday. And then the other side, so inner city wards, is a big issue. And the other is how we actually use the money as well. So Councillor Dowson and Taylor will tell you that we've had a lot of discussions around a small stretch of bus lane on Harrogate Road before you get to Port Newton Lane, where we wanted to kind of close and make a bus lane and close turning right onto Port Newton. Well, if we do that, then people will be. If you can't turn right onto Port Newton Lane from that, the money spent on that, then people will be using rat running. They'll use every other sort of way to get kind of, if you can't turn right there, then to kind of turn right. So I think we just need to be practical with some of our thinking as well. Just a one example. The third thing, the biggest number of complaints, certainly and I'm sure other elected members will agree, on here, whichever ward you represent, it's not about, and I do agree there's a degree of rat running, and, what Councillor Dawson said, it's not about rat running, it's not about, traffic jams. The biggest problems we get day in, day out is actually traffic calming and speeding. So when I say about that example about Harrogate Road, that money could have been well spent on actually traffic calming. I've just got email, well, we've got just email, I'm talking about Chapel Alton Ward councillors, Councillor Dowson and Taylor and myself, to get emails on an almost daily basis. I've just got something today which is about, speeding on Gledo Valley Road, and they've raised it before. We forwarded it on to, colleagues within traffic engineering. Nothing's come back. All they want is signs at the beginning, middle, and we haven't got. So I think we need to, although listen to what public want as well as obviously address some of those other, integral issues as well, Paul. Thank you.
Yeah, thank you, Councillor Sadiq. I think I agree with most of what you've said, especially around the public transport, and I think that's where we talk, if you like, in the strategy. It's very much about how do we move ourselves to that. The combined authority are looking at a partnership approach, which is contracted with the bus operators to try and change that. I guess the point is, if that doesn't work, do you go down the same route as Manchester where you do franchising? And again, but there is a point where the buses cost money to buy, they cost money to put the fuel in, and you have to pay the drivers, don't you? So there's a cost associated with running the buses, and we put already quite, the public put in quite a lot to keep those services running outside the peak times, evenings, Sunday services, etc. But should we be putting more in? Because most of those European examples that you will have seen and thought this is wonderful, it's hugely subsidized by the public. So it's public transport, but it's it is funded in that way, and we don't have that here. So it probably does need something at national level. There's probably some things that we can do as a mayoral authority that which is coming up, which you couldn't do before. So, but where does that funding come from to make it cheaper for people, to make it better for people? There is only one. You've got to find that funding somewhere to do it and to run it better. So it's a key challenge, but think more people on it, and then being able to repurpose other transport income that you get for that is the way to improve that. I think your traffic calming versus rat running. I think number of places across the city where we've looked at traffic calming, you put traffic calming in, it does slow speeds. It doesn't necessarily reduce the numbers particularly. So you're still going to get the numbers of people going through, but is that acceptable at slow speed? So again, that's the conversation you need to have with the residents on those streets who are, is it the speed is it the speed or is it the numbers? And so would they accept closures or calming? And they're the two solutions you can use on those areas. So you've got to look at the balance. Sorry?
Yeah, Councillor Rafiq, if you can just wait for Paul to finish that and then you could come back with a supplementary thing.
I think yeah.
Are you done with that?
Yep.
Yeah. Okay, Councillor Rafiq, you could come back with your supplementary that you had.
No, sorry, I'm just well, kind of agreeing and just saying that the worry is about, you know, speeding, and then the residential speeds and people going at a very high speed, and that worries people. That worries a lot of people, and you see this in just about every street, you know, in different neighborhoods. You know, no area is probably immune from that. You always get some idiots, you know, and I'm quite happy to use that word, because when it's at 20 miles per hour and you're doing 40, 50, it's not, you know, how are you going to have like families or young kids, you know, having, you talked about home zones and all that when people do that. So I think it's a serious issue, that one. They are obviously, I think they are linked, you know, running and speeding, but you find that, you know, speeding doesn't happen at peak times. It happens actually more at quieter times, when there's actually less traffic on the roads, when the roads are quieter, when less cars are parked as well. And that's why, you know, and I think residents are more worried, you know, when they can't guess, you know, and if you get out your house or your kids, and it's a worry, it's to the back of people's mind.
Thank you for that, Councillor Rafiq. I think we'll take the final question, unless there's anybody else other than Councillor Hamilton indicating to ask a question. So, Councillor Hamilton, your question
as well, please.
Or Councillor Wenham as well. So, final two questions on this agenda item. Thank you.
Well, I don't know if mine is so much a question. I just was going to say that with regards to public transport and how to get people out of the cars, it won't happen until we have a reliable public transport and bus lanes only, where obviously if we want people out the cars and we've got bus lanes only and we're queuing forever, you know, to get somewhere and seeing the bus going past, that would get us out of our cars. But until we have reliable, good public transport, we will always be in our cars. And if we do get that reliable, good public transport and bus lanes only, and we only have one lane for cars on certain roads, we will soon come out of our car, because we'll be thinking, if I'd walked, I would have got a bit further than being there. So that's what I'm going to say, and that's my problem. And until that come, I will continue using my car. With regards to speeding, it doesn't matter how much traffic calming we put in, there's always be that idiot that will speed. I mean, where I live, there's cars parked on both sides, and there's still speed. We've got 20 miles an hour. I don't want no traffic in the road up here, because it's narrow enough with cars parked on both sides, my neighbour, me, etc. So, and the only other thing, it's great to see all those cycle lanes. At this moment in time, they're empty, but hopefully once we're back out of this pandemic, I would like to see them being used, which I hope there will be, because I've got a couple of emails saying what a waste, you know, but people need to remember that we're still in lockdown, and there's not much activity out there. So I'm really pleased with a lot of the cycle lanes that I've seen, because it's nice for me to walk in them as well, especially when there's terrible pavements. So mine isn't a question, mine is just saying, until there's good public transport, we won't be coming out of our car.
I think we agree with that. That's why we're doing it.
Thank you, Councillor Hamilton, for your feedback and views on that. A final question from Councillor Wenham on this topic now.
Yes, I'll make it very brief. In the presentation, he mentioned about presentation about locality. You know, when we're thinking about locality, have you ever thought about approaching the local community in the area? I mean, for instance, like round here, we do get a lot. You get a lot of emails about speeding, parking, double parking where it shouldn't. That's something we should try work on, especially in the speeding. I would like you to actually, when you do get around to working with local people, I would like you to, for instance, approach the local community people to find out where the problem is, because there is a lot of rat run to as well go on in round here. That's all I have to say. Thank you.
Yeah, Paul, can you take that on board, some of the points raised by Councillor Benham? I know it's probably not one that you could answer regarding speeding at this very moment in time.
No, I think we are looking at ways we can continually map and understand the issues in various areas so that we can get a fuller picture of where we should be developing schemes and prioritizing them. And obviously, you know, when we do have schemes, we're absolutely looking at consultation with communities to make sure they are right for the problems that have been identified.
Thank you for your answer, Paul. What it is, Paul, I have raised this question with yourself previously, and it has been raised to the executive board member at the time, which was Councillor Lisa Mulheron, regards people with disabilities, trying to make sure the transport that, and the consultation to make sure there's something there for the people that have disabilities. So if you can look into that, it's not a question I know that you can answer at this very moment in time, but that is something that I have found missing in that consultation. So if you can see what is available and how we can make transport, even whether it's people on their electric scooters, to be able to get about, or people being pushed on their wheelchairs to actually get across the city, it is a situation where it is very difficult, mainly either due to the payments or the space being taken up by either parked vehicles on pavements and so on and so forth. So that's something that I found missing from the consultation. I would like to thank yourself and Mr. Finn Campbell for attending today. If you could just finally tell us when the consultation is closing, and then we'd like to thank you for coming to our community meeting and presenting the transport strategy to us.
It's the 26th of March, Chair.
Thank you very much, and thank you for attending our community meeting. And that's a thanks for myself and my fellow councillors as well. And hopefully people will be engaged with your consultation, and I hope you get many responses regards it. Thank you very much.
Thank you.
Thank you, Councillor.
Thank you. Right, and now we will move on to the next item, which is agenda item 10. We'll have Zach, our localities officer, giving us the finance report.
Good evening, everyone. Sorry about that. I was on mute there. If members could refer to the finance report, page 31, on the pack or the email that I've sent with the attachments today, and I'll happily go through to the finance report. The first item on the finance report, if I can refer to paragraph 17, which is our wellbeing budget. So I'll quickly go through table 1. As you all know, the total available balance for your wellbeing budget for the financial year April 2020 to March 2021 was £136,177.81. Take into consideration all your ring-fence budgets, include your ward pots and skips, your COVID-19 ward allocations, community engagement, festive lights, and your CCTV. That equates to £97,978.67. Looking at all the projects that went ahead during this financial year, they equated to £13,312.10. which leaves you an available balance of £24,887 4 pence. And that balance could be carried forward to the next financial year. Has members got any questions regarding that? I take silence as a no. I'll now move on to the new projects that was agreed at the last Inner North East Finance Subgroup. The first one is Wilderness on Your Doorstep. The total project cost is £34,795.72, and the ask was 7,350, which was agreed by the finance subgroup. And the second project is Summer Bands in Leeds Park 2021, and the total project cost is 1,950, and that's again coming out of the wellbeing budget for 2021-22. And the third project was Midsummer Night Showcase in Roundhay Park and Potter Newton Park. And the total project cost is £11,917, but they required £500, and that'll be covering the Chapel Allerton and Roundhay ward area. And the last project, which has already been agreed from the SIL budget for Chapel Allerton, is for a new shower facility and disabled toilets at Hayhills Baptist Church. The total project cost is £6,315, and council has agreed to fund 50% of the costs, which equated to £3,158. Are councillors in agreement with the projects that were agreed at the finance group coming out of the area-wide budget?
I will take silence. I will take silence as a full agreement from the members. In case anybody has any issues to raise, they could raise their hand or actually speak up.
We okay?
Yeah, full silence. Everybody's in agreement.
Okay. In addition to those projects being agreed, the finance group agreed to allocate ward pots of £10,000 per ward for the new financial year 2021-22. So that's 10k per ward pot. A community engagement budget of £1,000 for the full financial year. Chapeltown CCTV £3,000, and festive lights for the 3 wards £25,000. Are members in agreement with that? Councillor Azad?
Yeah, as chair, I would take silence as an agreement from all members. Is everybody in agreement?
Okay, thank you very much. Now the delegated decision notice, this is where projects have been agreed by emailing ward councillors in between meetings where there's not a committee meeting taking place. And the members agree, and I get it signed off by my head of service. So looking at those projects from the Wellbeing Fund, we've had Healthy Holidays Christmas provision from the Regional Centre for £450. A capital project, Gledhow Valley Road SID. I know one of the members alluded to speeding traffic in that area, and work is ongoing with highways to solve that problem by installing a SID in the area for £3,500.
Can I just ask, sorry, just on that, Chair, I know it's not probably related to finance, but Zach, whoever you're working with highways, could you ask them to just provide us an update where we are with it?
Yeah, no worries. Yeah, I can get an update. I'm sure it's been ordered. I ain't got an installation date yet, but I will come back to you as regards, where we are with that particular project. And the same with the Hare Hills Lane SID, agreed by the Chapel Allerton Ward councillors from the SIL budget, £3,500. And the rest are all ward pots agreed by the individual ward councillors. Chapel Allerton Spaces, Living Advent Calendar, £731. Meanwood Valley Urban Farm Defibrillator Project, £639. Steinbeck Defibrillator Project, £794.50 from Chapel Allerton Ward, and £794.50 from Moortown Ward. Any questions on the delegated decision notice, members?
Yes, it's not a question. It's just to say that you've the Steinbeck defib, you've put Chapel Allerton and Moortown. Well, the same should go for the SID at Gledhow Valley. Gledhow Valley Road.
Sorry, you got me confused there, Councillor Hamilton. So the Gledhow Valley Road said is 3,500 from the
Yeah,
area
it should be between that's between the two wards.
Right. The Gledhow Valley SID is an area-wide pot between the 3 wards from the capital project.
Is it?
Hay Hills Lane SID, yes, it is. Yeah.
Well, I've got it wrong then, because that's not how I that's not how I agreed it. But never mind.
Right. Okay. And the community infrastructure levy is ward base, so that Hay Hills Lane SID for 3,500 will be coming out from.
Yeah, you don't have to explain that one to me.
All right. No worries. All right. Okay. So are members in agreement with all that? I'll move on to the Youth Activities Fund.
I'll take silence as agreement from everyone.
Is that okay?
Yeah.
Lovely, great stuff. Right, moving on to the Youth Activities Fund. At the beginning of the financial year, we had £44,928 allocated for projects. I'm really happy to say that during COVID, a lot of organisations worked with us to retweak their programme delivery. And as a result, a lot of projects undertook in our area compared to other community committee areas. And the total spend was £29,267, leaving a balance remaining of £15,661. Any questions on that one? No. Is that okay, Councillor Sazad? Yeah, can I move on?
Yeah, that's absolutely fine.
Right, okay.
Chair, just before we move on, I don't know if it's here to say, well, yes, it does come under the youth activity. Just an email from Sinclair Brown, just to say that I'd like to say he was grateful for the, let me read it properly, if I read it properly instead of trying ad-lib. He's saying, I would be grateful if you could feed into the meeting how grateful the place schemes are to yourself from, well, he's saying to me and Councillor Rafiq for coming out to hand out the boxes to the children of the goodies. And it was well received by both parents and children. And I'm going to see if we can do it again for the Easter holiday. So this was about the half-term holiday where he provided boxes with things for Pancake Day, colouring and other things, and interacting with them on Zoom and including the parents as well. So he's saying thank you to all of us for that, and to me and Mohammed for going out and giving out the boxes. So obviously, yes, it comes under the youth activity.
Thank you for that, Councillor Hamilton. It's good to show that the money that we're investing in our youth activities is appreciated by the children and also the parents as well. Thank you for that. Zach, you can carry on now.
Okay, moving on to the ward pots budget. If I can refer members onto table 4. Obviously, the ward budgets are incorporating the skips and they are individually split per ward. Obviously, start of the financial year, Chapel Allerton had £14,611.25, Moortown £15,407.48, and Roundhay £13,633.94. Taking into consideration all the projects and skip spend, the remaining balance for Chapel Allerton is £10,865.85, for Moortown £10,521.17, and for Roundhay £11,119.84, and that balance could be carried forward to the next financial year. Any questions on the ward pots, members?
I'll take silence as agreement from all members.
Okay, moving on to table 5. This is where we had a number of projects that were on hold or cancelled, or they've started and they haven't yet finished because of the coronavirus pandemic. There was a 2019-2020 project, which was Heroes, Warriors and Leaders, the Moria movement. That project was to do with gang crime and youth crime. And they were going to do a really big seminar working with West Yorkshire Police, youth agencies across in the North East areas. and do a really big seminar to fill a hall up with about 200 people. Unfortunately, during the pandemic, that project didn't take place. They have got speakers coming from London, and they want to do it sometime in September, government rules allowing. That's that project there. And the rest of the YAF projects, which you can see on the second table, have all been cancelled because of government regulations. And then round here litter bins, there's been a delay with the order for our round here members. It came out their community infrastructure levy, and that is on track now to be completed by the end of March. Any questions on those?
I will take silence as an agreement to that.
Okay, moving on to the capital budget, paragraph 33 and the table 6 below. Looking at that budget, obviously the available balance at the start of the year was £46,348. We've had expenditure for St Martin's Stairlift, 2,500, Beccles Playground, 20,000, Moortown Park fencing, 11,270, and the SID device, 3,500. The available balance on the area-wide capital CRIS funding remaining is £9,078, and again, that can be carried forward to the next year. Any questions on the capital funding?
I'll take silence as an agreement from everyone.
Great stuff. Moving on to paragraph 34, community infrastructure levy. I'll just move on to table 7 on that particular one. And obviously the start of the year, the balance was 124,981.47, and it's split into 3 ward areas. So the breakdown for Chapel Allerton was £61,995.50, and with their spend, the balance remaining is, let me just get this right, total spend was £74,060.96. So the balance remaining is £70,560.96. The total spend for Moortown was £18,053.32, and the balance remaining is £8,053.32. And round here hasn't had much spend apart from the bins, and their balance remaining is £45,306.90. Any question on them?
I'll take silence as agreement.
Okay, just to let you know, I'm moving on to the coronavirus pandemic spend. There are 2 tables here. If you could refer to paragraph 35, and that's in relation to the spend to do with the government funding, which has to be spent by 31st of March 2021, and wheels are in motion to get most of the money spent. So if you look at that table and you look at the wards there, let me just get my cursor properly. Right, Chapel Allerton ward has spent 8,450 of their 10k spend. There is some projects outstanding to do with food bank and fair share membership, which will get them nearer the 10,000 mark. Moortown have spent 8,006, but they've got a Chromebook project throughout their ward area, and that'll get it spent up to 10,000. And round here have spent 4,381, and they've got another project to do with, you know, IT equipment for the digitally excluded, which will get them nearer the £10,000 mark, all being well. So hopefully we should be in a position to spend the 30k, the 10k each allocated to each of the 3 wards. Any questions on the government funding?
I'll take silence as an agreement.
Okay, in addition to that, at the beginning of the financial year, April 2020, from your area-wide funds, through the Chairs Forum and Councillor Deborah Cooper, 10k was split between each ward. And as you can see on the table below, it's got the spend figures there. So from the £10,000, Chapel Allerton spent £4,040, which gives them a remaining of £5,960. Moortown spent £2,092, which gives them a remaining of £7,908. That will be significantly lower with your Chromebook projects there coming out of this money as well. And round here, obviously didn't spend any money, but again, with the Chromebooks and IT, they might go into this budget. But again, they've got 10,000 remaining there. Any questions on that?
I will take silence as an agreement.
Yeah, I'd like to thank all the members for supporting me during the COVID-19 projects. Done some really good liaison work with various groups in the area. And that concludes my finance report, Chair.
Thank you, Zach, for your finance report. I would like to move on to agenda item 11, which is the update report. Zach, can you present the update report to us, please? Thank you.
Yes, certainly. Just let me go back. Okay, can I have members going on to the update report? It's page 43 of the pack of the additional document that I emailed you today. Can I kindly ask Councillor Sazad to give us an update on the Children and Families update part, please?
Yeah, thank you for that, Zach. The update from myself is great to see, as you've already mentioned in the report. We have had a big issue with people, well, not people, with children being excluded from school, not excluded in that way, but excluded in the fact that they couldn't actually carry on the work during the pandemic at home, because many children had an issue with either broadband or internet, but the main issue was actually having the items to use, i.e. whether it was laptops or iPads. I know the government did try to provide some, but I think because of funding being cut and so on and so forth, that was very limited in supply. So all three wards, I'm pleased to say, have picked up on this issue. And like you have mentioned, we've had Chapel Alton ward, they've already run a project which they've already provided 30 refurbished laptops. Well, they've provided up to 30 refurbished laptops to the Brackenedge Primary School. And in the Moortown ward, we're looking at providing up to 27 Chromebooks. And in the Roundhay ward, they have already provided 15 brand new laptops specifically for those children who are deprived from deprived backgrounds and have no access to digital equipment. So I'm really pleased for that. And also the youth service have done their best to engage children during obviously COVID-19, which is still running. And as you alluded to it earlier, we have been very lucky as a community committee that most of our youth activity fund projects were actually funded, and they actually did take place. So we have been quite lucky in that sense. So that's all from me at the moment, Zach.
Thank you, Chair. Moving on to the report, we've already had the update from Employment and Skills from Councillor Jonathan Pryor earlier. Can I ask members to refer to paragraph 21? And can I kindly ask our Environment Champion, Councillor Sharon Hamilton, to go through that, please?
Okay. Just to say, I'm not going to go through the full report. Just to say, with regards to the lockdown measures, the Cleaner Neighbourhoods team were able to update our risk assessment and safe working instruction for officers and staff on the front line and bring more services back. This is following the first lockdown. They tried to go back to a more area-based and zonal work in the wards as they did prior to COVID. Enforcement staff were dealing with a lot of garden bonfires due to residents being forced to stay at home. The bulky waste collection was taking place, and the thingy were all open where they had to make appointments to deliver the bulky weights. Due to the other national lockdown, the Cleaner Neighbourhoods team, I keep saying community, the Cleaner Neighbourhood teams have managed to keep more services running due to safety measures and that they had to put in place. They are still running at approximately 15 to 20% down on staff due to COVID-related issues. Staff who are clinically extreme and vulnerable are shielding, and other staff are off with COVID or self-isolating. However, this fluctuate in numbers. And so the service is still running, but with low number of staff. And then you can see the list. There's a list of the enforcement activities within the inner northeast area with regards to fly tipping, bulky waste, litter enforcement, vegetation, and that. And a few of them are down as well. So I don't need to go through much more. It's all there. And just to say thanks to all the staff for continuing to do their best at this most difficult time, and with so many of them having to shield and isolate and take COVID precautions. So big thank you to them, because it's still going on while most people are at home, locked up in their home, and not able to go out to work. So just we're just grateful to them to continue. That's it, Chair.
Thank you very much, Councillor Hamilton. Can we move on to paragraph 24? Can I ask Councillor Mohammed Rafiq, our community safety champion, to give us an update on the community safety portfolio?
Thank you, Zach, and thank you, Chair. With obviously with the virus and more and more people working at home, schools closed as well, hence more families, young people spending more time at home. That has actually resulted in more cases of antisocial behaviour, or rise in those cases, and our antisocial behaviour team have actually continued to work, given the challenges and COVID restrictions in terms of how you could actually see people. And in terms of the cases, in October, out of the 3 wards, Chapel Alton had 17 active cases, 4 were closed, Moortown 7, Roundhay 9. November, I think it's a very much similar pattern, with maybe a very slight variation, and the slight increase in Roundhay and Chapel Alton in December, although I think Moortown was around about, stayed stable. Actually, a slight decrease, 5 active cases in Moortown, whereas Roundhay was 9 in December. Roundhay was 14, Moortown 6, and Chapel Alton 22. So that's it, really, Chair, in terms of community safety, antisocial behaviour.
Thank you very much, Councillor Rafiq. Can I move on to the our health champion, Councillor Wenham? I understand that the public health colleagues have given quite a lot of update on the vaccination programme, and I understand that Councillor Wenham will just go through a few of the other bits.
Yes, I will. I'm not going to go through it all. Thank you. It's just to say that vaccine rollout has been very successful. And all I would say about the vaccine, some myths are going around saying that the vaccine have egg into and animal products into it, and definitely it doesn't. And all I would say is, if you get a call or something from saying that the vaccine, you can pay for the vaccine, please do not accept it. Do contact the police or call on 101. And all I would say, I'm not going to go through that bit. All I would say is the usual stuff. The vaccine has been a huge success, and people are getting complacent with the behavior. They should remember to keep the distance, wash their hands, wear face masks when on transport, in shop, or in health settings. And if you have any symptoms, please stay at home and call 119. Or if you have the symptoms and you have no family or support or friends, there's a telephone number which you can ring, which is 0113-378-1877. And that's all I have to say on it. Thank you.
Thank you there, Councillor Wenham. That concludes the champions bit. I'll just quickly go through the end bit of the report. I am conscious of time, so obviously I won't go into everything in detail. So if I can ask members to refer to paragraph 52 about housing advisory panels, just to make members aware, The Inner North East Housing Advisory Panel started the year with a budget of £39,109.79, which included a carry forward of £6,063.53. So far this financial year, 12 projects have been approved with an accumulated spend of £29,917.17. And basically, they've just given a breakdown that the projects that they've spent the money on, environmental and housing, equates to 42.23%, health and well-being 31.22%, and community safety 3.05%. They have got about £10,000 left until the end of March, and that money can be carried forward. Moving on to paragraph 55, the regional centre. Basically, they've been doing a lot of face-to-face work with their clients, and they've been offering a range of service, obviously being limited due to COVID-19 pandemic, and they are getting some services back in as the easing of government regulations. Job shop staff are currently working remotely with customers via email, telephone, offering the full range of service, including assisting with job searching, creating or updating a CV, completing job applications, and preparing for interviews. That's about it in terms of the update report, Chair. Do you want me to go through the social media update report?
Yes, you can do, but if you could keep it brief, because I think we've all had it.
You've all had it, yeah? Right, okay. Just bear with me.
Chair, while Zach
Yeah,
is looking, sorry, while you're looking, can I just say something on health?
Yes, you can do.
Yeah,
Councillor.
I'd just like to remind the public that at the moment we are focusing and talking about coronavirus, and seems like every other health issue stop. But I'll also urge the public, if there's any issues, the women issue, men issue, whatever it is, the doctors are still available to contact and go forward for any other health issue, because right through this is all pandemic, but there's other health issues going on in others' lives. So don't be afraid of consult your doctors.
Okay.
Thank you, Councillor Taylor. Appreciate that. Zach, have you got the?
Yeah, I've got the
social
report.
media
Sorry, I
report?
was looking at the PDF document. It's on a Word document here. Right. Okay. The Inner North East Facebook report includes the community committee Facebook page and the individual public Facebook pages to do with the individuals' wards. So since the 16th of November 2020, the Inner North East Community Committee Facebook page has gained 12 new page likes and currently has 1,013 followers. In terms of ranking from the 10 community committees, it's the 6th most popular Facebook page. And the most popular item on our Facebook page since the 16th of November to date has been the article about COVID-19 rates that are rising in parts of Leeds. It's a public health literature that we submitted on the Facebook pages. So that was the most popular one. That was in the first place. And obviously it reached 8 times and reached a total of 844 people. The second most popular item was the stay home, save lives message from the government, and 642 people had this post delivered with 4 reactions. And the third place was the Inner North East Community Committee post, obviously regarding the community committee meeting. 455 people had this post delivered to them. There were 5 post clicks and 3 reactions. In terms of the individual Facebook pages, coronavirus pages, we've got some data at the bottom. Looking at Chapel Allerton, there were 34 posts, 3 comments and 7 reactions. There's a graph there explaining the traffic and everything. Moortown, 39 posts, no comments and 16 reactions between the 16th of November 2020 to the 10th of February. And unfortunately, we've got an issue with Round here. in terms of getting the data downloaded from the Facebook pages. And that's due to the number of people that are on that group. It needs to reach a sufficient number for us to then go into Insight and get this data downloaded. So I'll have to do some work with the Round Hill Ward councillors to make that happen. Any questions on the Facebook reports?
No questions, Zach. Nobody's raising their hands, and I'll finally like to move on to agenda item 12, which can we get Natasha to give us the dates and times and venues of the meetings to come in the next fiscal in the next year?
Thank you, Chair. I promise I won't take any much more of your time. But yeah, agenda item 12 sets out the report of the City Solicitor seeking members' consideration of agreeing the 4 community committee business meetings for the 2021-22 year.
Yeah, Councillor Rafiq, if you could just mute your mic for us, please. Thank you.
Thank you, sorry. So the proposed dates and times can be found at paragraph A on page 62. And just to note that efforts have been made to avoid having more than one community committee on the same day. This just allows for officers to attend and for webcasting purposes, whilst we continue to hold meetings remotely. Please can I ask members to consider whether they're agreeable of the following dates. So we've got Monday the 14th of June 2021 at 6 p.m, Monday the 6th of September 2021 at 6 p.m, Monday the 29th of November 2021 at 6 p.m, Monday the 28th of February 2022 at 6 p.m. This sets out the committee's usual pattern with holding meetings on Mondays and at 6 p.m. Therefore, please can I ask members if they're agreeable with these dates and times?
Can I just come in there? I think Councillor Dawson is raising her hand. She might have a question. So Councillor Dawson?
Yeah, it's really difficult, obviously, while we still have the pandemic, and even despite the government's sort of rules, a lot of them are, it'll happen depending on these different things. So we're still not quite sure whether we'll be able to physically meet or not at this precise moment. But what we were discussing is actually having a business meeting, which is what we do now, but having it a little earlier, but then having more community engagement events. I mean, we're supposed to have 4 a year anyway. We were going to have one in each ward that would be weekend or evening, so that residents could come along and discuss different themes. Because, I mean, I don't know how many members of the public have actually joined us today, but business meetings tend to be quite dry. We could have had the transport as a separate residents meeting where people could come and talk about that as well. Potentially we could have had the COVID or health as an issue, or, you know what I mean? It's very formulaic having 6 o'clock on a set evening. It's very difficult. I'll point it out for next year because I don't think there's a lot we can do about it this year. But I would like to see more participation by members of the public, and we're not going to do that by mixing this kind of agenda with a themed agenda that people will want to come and talk about. That's just a point I wanted to make. I know there's not a lot we can do about it this year.
Thanks, Councillor Dawson. You raise an interesting point. I think Councillor Hamilton's got a hand raised. Councillor Hamilton?
Yeah, I was just agreeing with Jane with regards to theme meetings such as obviously the health one and the transport. I definitely agree that we said that's what we're going to do. But obviously things changed due to the pandemic last year and this year, and obviously going forward. But we still have to set these dates, don't we? So we don't really have a choice. We can, if we're out of lockdown, we can do this, can't we? And have our business meetings at another time. You know, so I'm just was agreeing with Jane about the theme meetings out for the public, as you know, rather, and then just have the business meeting. But we have to set these dates for now, because what they're going to say, there's not just Northeast Leeds to consider. So that's it. Just was agreeing.
Thank you, Councillor Dawson and Councillor Hamilton. Yeah, I think when I did become chair, that was one of the things that we were looking at doing. And as chair, I don't know if I will still be chair next year, but if I am, the actual theme meetings are something that we will definitely look into. And obviously the business meetings, we will obviously carry on as they are and agree with the dates as set, because as Councillor Hamilton has pointed out, for governance spaces and for officers' time and everything, these things have to be sorted out in advance. So obviously moving the time earlier in the following year, that could be a possibility. But I think unless anybody disagrees, are we all in agreement with these dates and times at the moment? I'll take silence as a yes. Yeah. Silence from everyone and agreement. So we're all okay with that, Natasha?
Thank you, Chair. Yes, of course.
And I think that brings us to the end of the meeting, unless anybody's got any other business to bring up. No.
Just to say, well, Chair, we're finishing on time, bang on 8:30, yeah?
Yeah, and I would just like to say to you all, thank you very much. Today's meeting was extended, and I knew because of the COVID vaccine rollout, it would get extended. That's why I asked for the extra half an hour, and really appreciate everybody participating fully. And thank you to the public who have been watching us for 2.5 hours as well. I have had a few messages. We have had quite a few people actually watching us, so I don't know what the exact figures are, but I have had some messages already. So I think Councillor Dowson has got one final point.
No.
With a hand raised? All right, your hand's still raised.
Oh, that's
Right.
It's been raised all meeting, Chair. So thank you for noticing. No, but just as I want to reiterate what Councillor Hamilton said. Well chaired. We've finished on time virtually. So thank you.
Thank you.
second that. Yeah, here.
Thank you very much, and I would like to thank all my fellow councillors and all the officers throughout the year. Obviously, with the pandemic, it's been a difficult time, but to actually get the meetings back online so the public can actually view them, and the fact that we have been able to have such interesting meetings online and get through agendas which have been quite complex, it's all credit to the officers and my fellow councillors. And I'd like to say thank you to everyone. And with that, I'd like to close the meeting, if that's okay with everyone.
Well done.
Thank you.
Thank
Bye.
you. Thanks.
Bye.
Thank-
Good night.
Bye. Good night.
Bye.